I'm going to start by reviewing the patient information and confirm the order for the Foley catheter. I'm going to gather the correct catheter kit, and also I'm going to bring a flashlight in case it's needed, and I'm going to bring an extra pair of sterile gloves.
Go.
I'm then going to perform hand hygiene. Hi, I'm Audrey. I'm going to be your nurse today. I'm here to insert a Foley catheter into you to help alleviate the pressure. Can you give me your full name and date of birth?
Mr. Timmy Scott.
Okay. Can I verify that? Alright, looks good. Do you have any known allergies?
Not that I know of.
Alright, perfect.
I'm now going to perform some hand hygiene. I'm going to put on some clean gloves. We've already completed step 1, so we don't have to do any of that. Alright, patient, so now we're going to go ahead and we're going to clean your peritoneal area, prepping for your catheterization. So I have this warm bath blanket I'm going to cover you with, and we're just going to expose the areas we need, which is your peritoneal area. So I'm just going to lift this up real quick. I now have a basin with some soap, water, and some washcloths. I'm going to go ahead and clean the peritoneal area. I'm going to start in the groin. Properly dispose of that in the dirty linen. Okay. Go down and make sure you use a different clean portion of the washcloth every time. And just like that, we're done. I'm going to dispose of this. I'm going to get rid of these gloves and prep my sterile field. So the bed is at appropriate working height. I'm on the side I want to be because I'll be inserting with my dominant hand, which is left. I brought in my own sterile gloves. I brought in the right catheter kit. I'm just going to take this out of this one. Okay, so when opening a sterile field, you should open away from you. This is a little wrinkly, so it's in different kits it'll be not wrinkly, so you want to make sure you're not going inside the sterile field at all. You want to open away from you, and the last leaf should be opening towards you. So now I'll be putting on my sterile gloves. So I don't want to touch inside of these sterile gloves. You can now just touch the little handles they've created to open it. The gloves, you open it like that. You don't want to touch you can only touch like the outside little border because this was the handle. So I'm going to use my non-dominant hand, grab the inside of my dominant glove, and making sure I do not touch the outside of these gloves. Have a little cuff. I'm now going to slide my hand in the cuff of my non-dominant hand's glove, and still making sure I do not touch the inside because the inside's no longer sterile. Once that is done, I'm going to look at my kit. I'm going to use this to slide under my patient, so I'll put that off to the side. This is a white thing, also the same material that you can put on. So now we also have these antiseptic swabs. They're already open to make it an easier process. We have lubricant, we have actually water, lubricant, and the second shelf we have the actual catheter, which is in the sheath, which will be lubricating. We have this container to collect any urine specimen, and yeah, so we're gonna first start out with opening this up. You want shiny side down, and we're gonna slide this under your patient. Easier way to do this is like sliding, like curling your hand like that. If you need someone, you can grab someone to help you lift up the hips, but that should be good enough in making sure you do not touch the patient. To put on the white, which is optional, this white pad, you're just gonna slide over like that. Like that. Alright, so in this kit we have the antiseptic swabs. We also have lubricant and the flush. So I already put some lubricant on this top tray. I'm now gonna move this All right, so now I'm gonna move my sterile field down to the patient, right onto this. All right, so what I have already opened is I opened the antiseptic wipes, not wipes, the sticks. I already pre-put lube on this tray, which is what we're gonna use to lubricate the catheter. I'm going to take the cap off. This is gonna be the liquid. Note how much liquid you're gonna be putting in the catheter, and you will be putting it in the orange port. Sometimes there are 3 ports, but this, according to this catheterization kit, there is just 2. So this catheter is in a sheath, and we're going to be taking it out and putting it into the lubricant, just like that. I'm going to disregard that. We're just going to set it in the lube for now. So now I'll be cleaning the patient's peritoneal again with these swabs. This is going to be my dirty hand now because I'm about to touch the patient. I'll be not using this hand again in any way. So I'm just going to grab the shaft up. I'm going to take my antiseptic, going to clean around, get a new one. You don't want to use it twice. Just get a new one. There's 3 in there. And disregard all of those. Perfect. All right. So now I'll be warning the patient that we're not going to be inserting the catheter. If you feel any resistance while going in, especially in a male patient, just have them take a deep breath in. So, patient, we're going to be inserting the catheter. I'll suggest you take a deep breath. I'm going to make sure this catheter is lubricated. More the merrier. Alright, so patient, I'll have you take a deep breath. We're gonna insert like so, all the way to the Y. Making sure you're not touching the patient with your other hand. So we made it to the Y. So we're about to put 10 cc's in the balloon. Perfect. Alright, so now I've inflated the balloon, and we're gonna now pull back until we meet resistance so it sits in a good spot in the bladder, which we've met. So some catheter kits have stat locks you can put on the patient's thigh and sit it just like that, like so, but we don't have it in this kit. So you're gonna properly put the catheter in position, usually on the side of the bed, like that. So now we're gonna take care of everything in the catheter kit and according to facility. So this will all go into the garbage. You would chart that you put 10 cc's into the balloon, which we did. We would mark how much urine output you're getting in the bag if there's any. If you need a urine specimen, you would use this port and you irrigate it. We don't need this in this case. And yeah, so we'll be taking care of that, and that's how you put a Foley in.